Hello, it's Bonnie Southgate, hEDS rehab here. We are looking at the shoulder further. So this is video number 3. And what I want to look at today is more the shoulder blade. Now, I don't have my bones here. I have them in my clinic, but I'm at home and I thought this heart was a really good way to represent the shoulder blade. So we've got, this is the bottom of the shoulder blade. This will be my right shoulder blade that sits in back. This is the medial corner, and this is the lateral side. And my collarbone comes in and attaches into here. When I lift my arm, I can only lift so far before either I'm going to cause an impingement here, or I'm going to take my arm and it's going to nosedive down and I'm going to sublux my arm. So what I need to do is have it rotate with me as my arm comes up and it comes back down. So you can see as the arm comes up, it starts there, and then from about there, that's the socket for my arm. And then as it comes down, it's going to rotate back. Now, important thing for us to think about, the muscles. So when my arm does that and I start to come up, my upper trapezius is what lifts this. It helps to bring the scapula into the correct position. On this side, so if you imagine, I have a muscle attached to this side, and I have a muscle attached to that side. One of them helps to bring it up, and the other one lengthens and stretches. And then when I bring my arm down, the other one tightens, and the other one comes down and stretches. So on the way up, my upper trapezius helps to pull it up. And then on the way back down, my levator scapula helps to pull it back. So we've got this wonderful orchestration going from one side to the other. Now, a lot of people, if they're here, that doesn't happen because you already have strain and tension on your upper trapezius. So it's already hanging and trying to help. And you've got elevation of the scapula in back. So I now have a tight levator scapula. I'm tight there because it's lifted it up. And then I'm a bit tight, but I'm also hanging on for dear life on this side. So we've already looked at getting the collarbones to lift. Now, we don't want to cue the shoulder dropping down our back. It doesn't do that. It does that. We need to cue not jamming our armpit down, because that makes it impossible for this guy to work and it makes it under tension. So we need to feel like we are not jamming our shoulder blade down. We need to give ourselves space under our armpit so that as we bring the arm up, the upper trapezius can do the lift like it should do. You can see my collarbone is starting to lift on that end. And then the levator scapula should lengthen in back. So the dropping down is centrally towards the spine. So when you think about the scapula dropping down, it's this bit dropping. This bit's actually elevating. So we need to think about that. And then when we come back, this bit is elevating and that bit's dropping. So if you find that you can't bring your arm up without feeling tons of tension in your neck or discomfort and pain, you need to maybe think about your levator scapula and not your upper trapezius. So I tend to like to find it by moving my hand across, and I might give a trigger point. And it's going to be the inside, the bit of the shoulder blade that's closest to your spine and at the top. And you can just hold your finger there and give it a bit of a trigger point. It attaches to your cervical spine. So as well as the upper trapezius, which comes into the base of the skull, it's affecting actually individual vertebrae, the levator scapula. So we're going to just give that a trigger point. And so we can tell that to relax. If I start by doing that, I don't stand a chance. I need you to think lifting up in the collarbone, lifting up here, letting the armpit go. So you have freedom. So I always start people almost with their hands under there. You can start with a bent elbow if you prefer, and you can start to lift the arm up and then bring it down. And I'm not jamming it down again. So if you initiate by doing that, you're going to find it difficult to lift your arm well. So you need to think you're floating. Put your hand here, float. You can then extend your elbow. Keep that. Bend the elbow, let it float down. I'm not jamming the shoulder blades down. Very often we see this jamming down and this strain here, pulling on the neck. Allow that strain to go away. Let it all float in space. So that is number 3 on understanding the mechanics of the shoulders. Hopefully that's helpful in understanding a little bit more that it's dropping down here, not here. Don't pull it down. Yeah. And there we go. It's Bonnie Southgate, hEDS rehab. If you're finding these interesting or you're finding them helpful, subscribe and also ask questions. I'm more than happy to answer questions. So I will be seeing you again with some other videos, and we'll keep educating ourselves on how we move. Thank you for watching. It's Bonnie from hEDS Rehab.